In my 30 years as a physician assistant in a variety of settings, hospice, hospitals, clinics, military, not military, in the field, in home care, I have experienced many of an inspection. I have actually helped organize large facilities no less than 9 times over the years, preparing for a JACO inspection. And what's interesting is JACO is not actually a make or break inspection. It's a voluntary inspection that is an accreditation of the facility, whether it's a skilled nursing care facility or a hospital or a clinic or surgical outpatient facility. It's a nice accreditation to have on the door. It is kind of a place that most facilities go now to have some sort of inspection process, because Medicare and Medicaid recognize it as valuable, that if you have passed the JACO inspection that you have met the Medicare Medicaid guidelines. It, however, does not necessarily pass you on other inspections like OSHA and CLIA in other specific areas. CLIA is for the lab, OSHA is for safety of employees and people who use your building, and there are many other inspectables. So in week 9 and 10, you're going to be looking at the quality of your care and the outcomes of the care that you are providing in your virtual skilled nursing facility. And we will be looking specifically at how you take all the pieces and parts of your population, the people who take care of your population, your building, your physical plant, your environment of care is the proper terminology, and make all of those pieces and parts fit together, have a process by which everything is documented and properly set in its place and findable and reproducible and whatnot into the inspection process, which is really all about quality. In 1987, you'll read that the OBRA laws came into effect, which was essentially a nursing home reform bill that the United States Congress put in place, much like the HIPAA regulations and the Patient Self-Determination Act that came sometime later. All of these processes are ways for the people who pay the bills, which would be the government for the most part, to ensure that quality care is being delivered to the patrons of a facility. So in this case, in your virtual skilled nursing facility, is the patient getting fed 3 times a day? Are they being fed food that's being kept cold if it's supposed to be cold, or being kept hot when it's supposed to be hot? Are there choices for the patients to make versus just being handed a tray of swill and being asked to eat it? Is there a nutritionist who is following the needs of the diabetics and the special diets of AIDS patients or an Alzheimer's patient? Is there a physical therapist or a team properly equipped to take care of the physical needs? Are the CNAs actually delivering the activities of daily living to each and every patient properly? Is that being documented? We get back to that documentation point. Is the facility manager double checking that after the cable guys have been up in the ceiling putting new cable into all the rooms for the patients, did they knock any holes through the firewalls? And I can guarantee you they did, because I used to have to go up and inspect before and during the year to make sure that the facility manager person was doing their job, which was to check for holes in the firewall. Is the safety of the facility being covered? Things like, do you have anything within 18 inches of the ceiling that can fall on the patient or your employees. Most classic place for this, and I love all, and I can't think of any place I've ever been it wasn't this way. The locker room for the employees. You got the lockers, and they're all there locked like they're supposed to be, so everybody has their privacy and their clothes don't get stolen and whatnot. So the lockers are there, but on top of the lockers there's boxes and Christmas decorations and somebody's lunch and this, that, and the other. Well, by the rules, you're not supposed to have anything within 18 inches of a ceiling or more than X amount above your head that can fall. So it sounds silly. Why can't I put the Christmas decorations up there? Well, it's a fire hazard, and more importantly, it can fall on your employees. The OSHA regulations and the specific patient safety regulations that are put into place are there to keep people safe. Standing on a rolling chair to put the clock back up on the wall when you've changed it from daylight savings time is not a safe activity. And I can tell you that people do get hurt. I took care of a lady who was putting fresh curtains up in her office, and she was standing on a desk that was near the window but not in front of the window, and she was in stocking feet because she was wearing heels. I'm glad she didn't get up there on heels, but she's in stocking feet on a slick desk, and she's reaching over to put curtains over. What do you think happened? Of course she fell. She broke 5 ribs and was in the hospital for 3 weeks and had pneumonia and a lot of complications. This is a pure out and out dumb mistake. You don't stand on a desk in stocking feet, put up curtains when there's a step stool in the logistics closet 4 steps down. It would have taken her 15 seconds to go get to do something that then put her in the hospital for weeks and weeks and weeks.